Peripheral intravenous catheters are routinely placed for administration of IV fluids and IV medication. In this program, we will overview the proper placement of catheters in the peripheral veins of dogs and cats. The most typical vein accessed for IV catheter placement is the cephalic vein. If this vein is not a choice due to trauma of the forelimbs or poor veins, the lateral saphenous vein can also be used. Since the techniques are quite similar, our focus will be directed toward placing a catheter into the cephalic vein. Prepare the following material before beginning the procedure. For pediatric dogs or toy breeds, use a size 24 or 22 gauge by 1 inch long over the needle IV catheter. For cats and small breeds, use a size 22 or 20 gauge by 1 inch long catheter. For medium breeds, use a size 20 or 18 gauge by 1 to 1.5 inch long catheter. For large breeds, use a size 18, 16, or 14 gauge by 1.5 to 2 inch long catheter. A clipper with a disinfected size 40 blade, 1 inch and 1/2 inch adhesive tape. The 1/2 inch tape can be prepared easily by ripping the 1 inch tape lengthwise. Isopropyl alcohol, chlorhexidine or betadine scrub, 7 cotton balls, 4x4 gauze, a tourniquet, a Band-Aid, triple antibiotic ointment, 3 cc heparin flush. This flush can be made up by mixing 5,000 international units of heparin diluted in 1 liter of normal saline solution, and a tea set filled with heparin flush. This tea set offers an additional injection port near the point of entry. Wash your hands thoroughly before beginning the procedure. Once you are ready, prepare 3 to 4 strips of 1 inch adhesive tape, approximately 3 times the diameter of the extremity. Next, prepare 2 strips of 0.5 inch adhesive tape, one approximately 3 times the diameter of the extremity, and the other approximately 2 inches long. Place these tape strips on the edge of the table that you are working on. Remove all hair over the cephalic vein and all the way around the extremity with the clippers as seen here. Soak 4 cotton balls with alcohol and 3 with chlorhexidine or betadine scrub. Surgically prepare the entire clipped area by starting at the designated entry site for the catheter and wiping with an alcohol-soaked cotton ball in a circular outward motion. Alternate between alcohol and scrub-soaked cotton balls. The 3 scrubbings and final alcohol wipe will produce a clean site for the placement of the catheter. Using a dry 4x4 gauze, dry the area on either side of the vein, but do not touch directly over the vein. Once you have surgically prepared the catheter site, wash your hands again. For increased visualization of the vein, have your assistant hold off the vein above the catheter site just below the elbow. Use your hand to hold the distal leg and apply mild traction to the skin on either side of the clipped area. This will help you to be able to see and stabilize the vein. With your other hand, hold the catheter with the needle held at a 15 to 20 degree angle to the vein with the stylet bevel pointed up. Use the hand that is stabilizing the extremity to simultaneously hold the hub of the catheter stylet. Be sure to start at the distal end of the vein. This way, additional attempts can be made further up the vein if the first placement is missed. Insert the stylet and catheter through the skin and into the vein using a steady forward motion until you see blood flow into the needle hub. This should occur with minimal resistance if in the proper location. Remove the stylet from the catheter and attach the IV T-set or injection cap. Without touching the catheter, the hand can apply slight pressure over the tip of the catheter to minimize bleeding while the T-set or cap is secured. Inject the catheter with sterile heparin flush and observe for swelling or formation of hematoma under the skin. If swelling or hematoma develops under the skin, remove the catheter and apply a temporary pressure bandage using a cotton ball and 1H tape. If this occurs, select a new entry site further up the leg. Use the longer strip of 0.5 inch tape to secure the catheter hub around the extremity. Place a Band-Aid with triple antibiotic ointment over catheter insertion site as shown here. Wrap a strip of 1-inch tape around the catheter hub and Band-Aid, securing them to the extremity. Anchor the T-set to the hub of the catheter using the shorter tip of 0.5-inch tape in a V fashion. Next, wrap a second strip of 1-inch tape over the anchor and catheter. If fluids are being administered, attach the fluid administration set to the T-set. Open the IV line and observe for adequate flow into the vein. Continue to also observe the leg for swelling associated with an improperly placed catheter. If fluids are not being administered, screw on the IV injection port and inject the port with heparin flush. Wrap another strip of 1-inch tape to secure cap to extremity. Tape is not likely to stick to wet surfaces, so if there is fluid or blood present on the leg or items to be taped, clean and dry them prior to taping. A catheter will require regular inspection to assure it is working properly and not becoming a site for infection. Remember to wash your hands before handling or inspecting the catheter site. Inject heparin flush into the injection port closest to the catheter every 6 hours to prevent a clot formation. Do not forcibly push a clot into the vein if there is a blockage. If the catheter is not patent, it may need to be replaced. Carefully remove the catheter if it becomes partially dislodged or bent. Replace the tape if it becomes wet to prevent dislodging of the catheter. The tape will need to be loosened if swelling occurs distal to the catheter site by using bandage scissors to cut the tape along the lateral aspect. Reapply tape to secure the open area, being sure it is not as tight as before. Inspect the swelling frequently to ensure it reduces and replace the catheter in another leg if the swelling does not resolve. If the patient licks at the site, or if the patient is left unobserved, place an Elizabethan collar to prevent licking and chewing that may result in the premature dislodging of the catheter. When it is time to remove the catheter, follow these steps. Have a cotton ball and 1-inch tape strip approximately 3 times the diameter of the leg prepared. Using bandage scissors, cut through the tape along the outside edge of the leg. Pull the band of tape away from the skin on either side of the catheter. Remove the catheter and tape together in one gentle motion, as seen here. When removing a catheter, make sure that the entire catheter is present upon removal. Save the tip for culture if redness, pain, or swelling occurs at the catheter site. Place a temporary bandage on the catheter site using a cotton ball and tape. You can usually remove the bandage after 15 to 20 minutes. If excessive bleeding occurs, rebandage and alert the attending veterinarian. Have the pet owner monitor the site for excessive licking and place an Elizabethan collar on the patient if this occurs. If the pet is sent home with a bandage, be sure to properly instruct the pet owner as to how to care for and remove the bandage. This section has introduced you to the technique of placing intravenous catheters in dogs and cats. This is routine procedure that you will perform frequently as a veterinary technician or assistant. Like many of the other skills taught in this series, you will need sufficient practice to gain proficiency with this procedure.